I'm Elmarie Asad. I'm a patients professor, unit manager at Blue Cross Blue Shield of Illinois, also a patient living with a rare disease. And I'm really excited about the opportunity to have this important discussion today. Wanted to just welcome everyone. I'm really looking forward to this wonderful discussion regarding overcoming systemic oppression and improving healthcare delivery. And this is such an important discussion. I want to ensure that we have time to get to your questions, but also hear from the dynamic panelists that we have today. And so we'll get started. We'll start with asking each of our panelists to introduce themselves and share one reason why this conversation is important to you. And we'll start with Lillian.
Hi, everyone. I'm so happy to be here today, and I'm looking forward to the discussion. So my name is Lillian Mehran. I'm the founder and principal consultant at Reframe Health LLC, where we offer community health education and research consulting to promote equity and justice in health and healthcare. And oh my gosh, there are so many reasons why I think that this is important. It's hard to pick this one, but I would say that when we're talking about the healthcare system, we rely on this system for our well-being and, quite frankly, our lives. And so oppression within this system is not just a threat to individual visits with physicians or singular experiences within the system, but it really can impact our lives and our well-being, ours, our loved ones, our communities. And yeah, I think I'll stop there.
Thank you, Lillian, and welcome. Next up, Aneri, if you don't mind introducing yourself and one reason why this topic is important.
Absolutely. Thanks for having me here. I'm excited to join you all. So my name is Aneri Patani. I'm a senior correspondent with KFF Health News, which is a national nonprofit news outlet that focuses on covering U.S. healthcare and health policy. I generally write about mental health, substance use, but also sort of a broad array of topics in the health world, including a series we did with NPR on medical debt and how it affects patients across the country. I think the conversation today is important, as Lillian said, for a whole host of reasons, but kind of one that resonates with me and my work is that there's this real severe imbalance between patients or consumers and the rest of the healthcare system. And part of that imbalance, there's many reasons for it, but part of it is about knowledge and access to information, and who can ask for information and be given a response. So I think having this conversation today where we can share some of that knowledge and tips and information is sort of a very small step towards shifting that power balance.
Great, great. Thank you so much, Aneri. And Laura, last but not least.
Good afternoon. I'm Laura Bray. I'm founder of Angels for Change. I run the nation's only nonprofit patient advocacy organization with a mission to end drug shortages. I'm also caregiver to a pediatric cancer survivor. And the one thing I, want to talk about today or share today and why this is so important is the supply chain that fills the hands that save our people, that makes the medicine, it's broken. And just like any time there's brokenness, there is real disparity. And those that can navigate the brokenness are getting access to the scarce supply at much higher rates than those that don't know how to navigate the brokenness. And when you have a broken market, and as Aneri said, an information gap that even widens the disparity that's happening about who is getting access to our essential medicines and who is not.
Thank you, Laura. I really appreciate that. I love the term navigating the brokenness. I definitely wrote that down. I'll probably use that very soon. So let's get started. Let's talk health privilege. What is it? And why is it important for everyone to recognize how health privilege tips the scales for patient safety and quality?
I think health privilege can, affect quite a few things, but I think, in the context of our discussion, one of the things to keep in mind is that there are some folks that need to navigate the healthcare system more than others. There are some folks that have chronic conditions, have acute concerns. There are a multitude of reasons why someone might need to navigate that. And so for everyone else that hasn't yet had this experience, I think, the healthcare system and the oppression that exists can be kind of invisible. And so it really puts a burden on those who are having to navigate the system to, one, even identify what some of these issues are, two, how to navigate them, and three, if they have any bandwidth at all, try to advocate for themselves and their loved ones through this system. I do want to note one thing. I said yet on purpose, because one thing that we see, especially as we continue through our lifespan and age, is that even folks that haven't had to navigate the system yet usually will at some point in their lives. And so even if this is something for an individual at a given time that doesn't seem relevant, for almost all of us, I promise it will become relevant at some point.
I think that's a great point, and I'll take it back a little bit further. Until 5 years ago, our family had a ton of health privilege. I had never actually been sick. Neither had my husband. We went to our doctors for an annual checkup, basically all five of us, my husband, myself, and my children. We were low users of our healthcare system. That changed the moment my middle child was diagnosed with pediatric cancer. We became high users of the healthcare system and an orphan class, right? Pediatric cancer is an orphan class. There are, now all of a sudden, not just navigating the healthcare system, but navigating society as a whole changed for us. Can she go to school? What does school do for her? What can't it do for her? How does she still be educated? Our goal is for her to continue to survive. So she can't just not be educated for 3 years, but how do we do that? There's so much that we were unprepared to even figure out how to navigate, because before that, we navigated this world as though we were very healthy. We were healthy Americans, which in general, the majority of people for most of their lives are fairly healthy. And then all of a sudden you're in this space where you've lost health privilege, and it is a very, the world kind of drops out from you, and you have this realization that, oh my gosh, this is how some people have had to navigate their entire lives. It opens your eyes to what Lillian said was the invisibility, right? And I had opened my eyes to tons of other areas where there was disparity, but because I'd never experienced it before, right? It was invisible. And then you try to figure out, how do you navigate it? So it's that invisibility that, because in general, most Americans are fairly healthy until they get to later ages in life. It is part of it. And how do you bring that to life to the majority of people while they are not experiencing it? And, that's part of it. And, my husband and I both had this, oh my gosh, wow, this is difficult. And it wasn't because we didn't want to know. It had never been part of what we've had to experience.
Thank you, Laura. Aneri, did you want to chime in as it relates to the question as to health privilege?
Yeah, I think both Lillian and Laura covered it amazingly. I just wanted to add that in my job, I'm often talking to folks who have suddenly found themselves encountering the healthcare system. And it is exactly what both of you said. People don't anticipate it and don't spend time thinking about it, because generally it's a negative experience that leads you to interact with the healthcare system. We don't spend our days sitting around thinking about it. I'm not saying we should either. But when it happens, what occurs is, the folks who are in the middle of some sort of crisis are the ones seeing the problem, and therefore the burden of advocating against this oppressive, unfair system falls on people who are already in the middle of a crisis. And so this is how I think health privilege kind of tips the scale towards keeping the system as it is, because those with more who are not in crisis don't really see the issues that need advocacy, and those who are in crisis are trying to advocate, but also trying to deal with their own health issues at that time.
I'll add one more thing, because you're so right. you're in crisis. It's an incredibly cruel place to find yourself to then figure out how to navigate the system with very little help or information. But you figure it out because you're in survival mode and you have to figure it out. But once you reach the place where you maybe make it to survivorship, right? In general, you want to just move forward. You want to bucket that whole crisis into a space that you don't look back on, because it is very difficult to look back on. And that's also why things stay the same. And it is human nature, right? I want my patients now to be able to have that, where they can move on with their lives. And I hold that burden to change the way the system works now.
Yeah. Thank you. Thank you, ladies, for those comments. And definitely, the conversation can go on longer, but I know we want to get to the rest of the questions. So in our planning session, we talked about how structural oppression can be explicit, right? Visible and loud, and so as well as insidious. One of you even said it hides itself. It could be quiet. What are thoughts and comments about that? How can it be insidious and quiet?
So I'm just going to speak from drug shortages, and many people may not know what drug shortages are. Our pharmaceutical supply chain breaks more frequently than it ever has. There's 325 drugs currently on shortage. They stay short longer, up to 3 years. And that shortage doesn't necessarily mean nobody's getting supply. Those that have more means are getting supply, and those that have less means may not get supply for 3 to 4 years in crisis situations. So it's the entire system that is misaligned. The FDA says it's a broken system, right? So how do you solve something when systemically it's broken and each individual is just a member of that? And so what can be quiet is the solutions that build up around the members of healthcare that kind of allow them to not see the broader picture, but maybe make it even harder for patients to navigate. And so what I mean is, if you are a member of the system and the system is broken, you can't fix the entire system. So you have to shield yourself from that brokenness. And in doing that, you can lend yourself to accepting policies and procedures that you would have never accepted before. So in the drug shortage space, that would be saying, well, I have it for my patients. That's no one. I don't need to worry about anybody else. Or, hey, this happens and it's not my problem.
Right.
And that can be some of the quietness of like systemic brokenness, is that everybody feels alone. Nobody knows how to solve it. So instead they, compartmentalize their piece or shift the risk to somebody else. And unfortunately in healthcare, when we're saying shifting the risk to somebody else, it always ends there at the patient level. And it's the patients who bear all of the risk of non-supply, of not getting access to medicines. And as Aneri said, their most crisis and cruel time. And so that's the quietness, is every member feeling helpless. So they do what they can to make sure they have what they need, and they're not part of the problem, which means they're also not part of the solution.
Yeah. Thank you, Laura, for those comments. Definitely medical gaslighting happens more frequently, and the patients are the ones that end up on the bottom end of that. I certainly experienced that myself when I started experiencing symptoms, and my primary care physician, ignored them. And so for months, it went unnoticed, it was not prioritized. And then at some point I had to say, what are next steps in order to, move on to the next level, if that meant finding another provider, which is eventually what I had to do. So medical gaslighting is a real problem. And for Lillian and Neri. How might this happen and what can someone do to combat it? And Neri, I think I want to go to you for this one because I know you're working directly with quite a few patients on this.
Yeah, I think hearing what you just shared about your experience, I hear that from so many patients. And the thing that I have seen other people do is often ask for things in writing. I am telling you I'm having these symptoms. Can you document it in my medical record and document that you're choosing not to, order this test or whatever it is. Sometimes I have encountered patients who have said to me, hey, I asked for my medical records and I couldn't get it, or the place was going to charge me some exorbitant fee. In which case, sometimes I will say, like, what you could do is write up right after an appointment or something, write up your recollection and experience of what happened and who said what, and email it to your provider. So it's still a written record. It's created right after the part. So it's documented some way. Obviously, ideally, they document it for you, but if not, we can document it for ourselves and we can CC people on those emails. Others who are in our support system so they know what's going on, but also maybe the provider, the head of the practice, or the provider's supervisor, whatever is needed to kind of call attention to what's happening.
Yeah, I love that. I remember that from our planning session, and I have certainly made a note to continue to do that in my visits as well. Lillian, did you want to chime in?
Sure. So just because you mentioned access to records and fees, I just want to note that it's not legal for them to withhold your access to your medical records. There are some limited exceptions around mental health records at very specific times. They also can't charge an arm and a leg. So just to note that there are rights here, and these rights, as Aniri mentioned, sometimes are not recognized, not honored, not respected. One other piece I think that makes this difficult is that our healthcare experiences are very often private experiences. And so often, we only know what's happened to us. We're not able to see all patient records. We don't know what's happening more broadly. I can give one example. So years ago, I was working at a community health center. It was primary care. And so one of my roles was to help patients who needed to see specialists, cancer doctors, heart doctors, get appointments, get insurance approvals to be able to do that if necessary. And many of our patients were on Medicaid. And I would call one particular office and I would say, hey, I'm trying to schedule an appointment for my patient. What insurance does the patient have? It's always one of the first questions, sometimes even before the name. Oh, Medicaid. Okay, well, the next appointment is in 6 weeks. Call back that afternoon. This patient had private insurance. When is the next appointment available? 2 weeks. Now, the patient with Medicaid may not know that if they'd had a different insurance, they could get in 2 weeks. The person with private insurance just says, hey, great, I only have to wait 2 weeks. But this is something that only because I was in the role I was in within the system, I was able to recognize that there was something going on here. And I also think that because these are private experiences, and I'm not saying that they shouldn't be, but as a result of that, sometimes it can be hard when something is going on to say, wait a minute, is this impacting me? Am I being treated this way because of my identity? Am I being treated this way because this is just protocol of the hospital? And sometimes it can be really hard to answer that. I mean, sometimes the experiences are so explicit and overt that it's without question that it was race-based or sexual orientation-based or something like that. But sometimes, especially as was already talked about, where you're already in this really vulnerable situation, like, I don't know what to make of that. And in many cases, we're just desperate to get care, to get a diagnosis, to get medicine. And sometimes the oppression is also not coming from physicians. Sometimes our clinicians are also on our side. It's the folks they have to report to, the administration, the broader system, insurance companies who are causing this. And I think, that's another piece that's important to recognize here, that, there are so many pieces that just folks may not know about because we have these kind of isolated experiences. We don't get to see the bigger picture a lot of the time.
Yeah, no, definitely, Lillian. And you bring up some really valid points, especially as it relates to Medicaid versus private insurance or PPO. In my instance, thankfully, as you mentioned before, sometimes even asking your name, the question is, what insurance do you have? Because that determines how soon you get in. And I probably would not have gotten diagnosed with my rare disease had I not had a PPO and was able to get in within a week and get diagnosed within a week. to go to a different provider. And unfortunately, I'm sure for so many, they go undiagnosed as well because they don't have that access. And so that goes back to the health privilege that we talked about earlier. I'm going to go to the next question. And Laura, did you have anything you want to comment as it relates to that? Or we
just real quick, along
Sure.
with Aneri's suggestion about asking to put it in writing, I have found both as a caregiver and patient, but also as a patient advocate, that curiosity is very helpful. So responding with questions, help me understand, how does that is that what is medically recommended right now? Like I have found turning it into questions with real curiosity. Like, is this how you help? I'm a parent, you're a parent. Help me understand what you would recommend for your child right now. Turning things into questions instead of, for understanding. And then also because that makes people stop sometimes and not just explain, but also realize maybe they're just quickly going through the motions to get to the next thing and in a very operational way. And your health isn't operational, right? Your health is very, very emotional and sacred. So that's my one thing. So yes, get it in writing, ask for them to write it down. But I also, when I'm navigating a drug shortage for a patient, I'm like, help me understand. If you can't help, is there somebody in your organization that is the one that can help? Who is the person that handles this? You don't have a policy and procedure around drug shortages. Oh, so is every employee allowed to navigate this differently? Like, oh, no, we do have a policy and procedure. It's this person that does it. Oh, great. Thank you. Can you transfer me to that person? So just asking questions sometimes, it can be power.
Thank you, Laura, and thank you, Lillian. On this next one, I'll start with Aneri, and then open it up to the group. What is risk shifting, and how does this impact accessibility and quality of care?
Yeah, so I think to talk about this, like risk shifting, many parts of our healthcare system are framed around profit. And that kind of goes hand in hand with liability, right? Hospitals, doctors, pharmacies, et cetera, don't want to get sued or be held liable in other ways because it decreases their profits and overall tarnishes their image. So generally, they're going to do things that help with their profits, for example, like pushing large bills or maybe not having the most generous financial assistance policy, or having the policy but not enacting it so that patients know that they're eligible for it, for instance, because those are kind of opportunities that the risk is on the patient. If the patient doesn't pay, they would face the medical debt, they would face the issues. And the risk on the provider side is just kind of, we're asking them to pay a bill and we have this policy, but until someone asks about financial assistance, we don't have to offer it. But what I see happen is when I, as a reporter, call on behalf of a patient and say, hey, I'm writing an article about this bill and you have put this person in collections and they weren't offered financial assistance, sometimes the bill magically goes away. Or the provider calls the patient and says, let's work out a payment plan. And what I think my understanding of what happens there is that the risk calculation shifts, where basically now the risk is not just the patient could end up in medical debt, the hospital sees, or the provider, whoever it is, sees themselves at risk for liability, for bad press, whatever it is. And unfortunately, the thing is, I can't call or do a story on every person who is mistreated or gets a bill by the healthcare system. So there have to be other ways where we can kind of shift that risk calculation from the patient onto the provider.
Yeah, thank you, Aneri. Two of the words that I wrote down, and I just want to hear from Lillian and Laura just really quickly on this one, was money and liability. What comes up for you when you think about these terms, and from a patient advocacy perspective, how do you think it should be approached?
So first of all, this is why patient advocacy is so important, right? To ask those questions, because when money and liability in the healthcare system are misaligned with patient care, that's where we have the brokenness. And so, ideally, the liability would be, not caring for the patient and the liability, that would be an alignment there where, and things do function in the healthcare system. There are things that function where motives and patient care are completely aligned. And so what I hear when I see that is, there's some sort of barrier, there's some sort of misalignment. And how do we infuse patient-centric care and design into this process so that patient care wins at the same time as money and liability? And that's kind of what I hear. Oh gosh, yes, there's a misalignment between the profits and the liability of care and actually patients receiving care. If you talk to the individuals in the healthcare system, they didn't get there by accident, right? They're people of goodness who want to save lives. And so, okay, there is some sort of systemic brokenness that is misaligning saving lives with the money of healthcare. How do we, as patient advocates, go back through that healthcare system and realign it so that the liability, as Aneri did such a great job lining up, the calculation of risk is now aligned with the patient's lives?
To add to that, I think, one of the things that came up and Yuri had mentioned is the importance of records. And so when we had a discussion, when we were planning out what we would chat about today, one of the things that came up was, if, let's say you know that something is wrong in your body and you're trying to get, let's say, a scan to figure it out, and you're met with resistance. Sometimes what works is to say, okay, I would really like you to document in my medical record that we had this conversation, what my concerns were, and that you have determined that I should not get imaging and why. And very often that'll change the conversation. And one of the reasons that it's changing the conversation is because now there's a liability concern. And so sometimes liability can almost serve as a point of advocacy, as sad as that is to say. The other thing is, as Laura mentioned, there are providers that go into this and they're doing this out of the goodness of their hearts, and they're being told, hey, that 15-minute slot that we always reserve for your patients, well, you're going to get 10 now because we want you to see more people. So they're also constantly dealing with challenges on their end too. And actually, speaking of money, a study just came out that found that medical workers actually have some of the highest medical debt in the country. And so they're also patients in many cases that are navigating the systems too. And hospitals in many cases have really fierce collections processes to try to get their money. And so, I also want to recognize that. But so when we're talking about liability and money, certainly within the healthcare system, and if we kind of start to narrow that down, let's say hospitals, this is also where using liability can kind of advocate. Within health insurance companies, this is also something that comes up. Certainly I've been through this. I suspect, many who are here might have been through this, where a medication is not covered or a procedure is not covered. And then there's an appeals process. And it's not that your clinicians are saying they don't agree you need it. They're on your side. There's a whole process that has to go through. And this is also a place where, costs factor in. They don't want to pay for it. The health insurance company doesn't want to pay for it. Very few people have the means to pay for some of these things out of pocket. And that's not a sustainable option. And so this is another area where there can be problems. In many cases, appeals can go up to the state level. So it's someone outside of the insurance companies who's making the ultimate determination. And we've also heard cases where insurance companies, had been having a denial spree of things that come through, claims that comes through, pre-auths that come through. And there, I think it was several years ago, they found out that one of the health insurance companies were not even having clinicians look at some of these. They were kind of being administratively denied. And so there are a lot of areas where, money and liability come into play here. And yes, sometimes that happens, face to face with the clinicians, but there's a whole system behind them that's also impacting their own ability to do what they think is necessary for their patients.
Yeah, well, thank you, Lillian. I really appreciate that. So this is our third session in this year's ASTARISQ series. I cannot believe this is the third session. We're almost done this summer. Summer's almost over. And each panel has mentioned the role of data And working in healthcare, data is so key, even in community engagement, which is what we're doing on my team. What role does data play in systemic oppression? And alternatively, how can data improve healthcare delivery? So I know that's a tricky question, right?
I can chime in because this, I think, when you asked me kind of why I think today's discussion is important, it's about
Yes.
access to information, right? And I think that same thing applies to data and healthcare. There's just such an imbalance when you think about very basic questions like, is this procedure necessary for me? What are the risks and what are the benefits to it? How much does this actually cost? How much will my provider charge? How much does insurance cover? All of those are really, really basic, but actually getting those answers as a patient, from speaking from personal experience as well as talking to lots of patients, can be really difficult. And if that data was simply made more easily accessible, right now, as a reporter, I know how to look up a CPT code and go to certain databases that will show me like, hey, if a procedure has this code, what is it typically charged, or what is it charged in a different state? And I can compare those. But like, I can do that because I am paid to do that and it is my job and I spend my workday doing that. When I had to do it for my own procedure, I wanted to get a cost estimate. I was spending hours outside of work making calls and researching things. And the average person doesn't have that time and privilege to do that, honestly. So if that sort of data was made more easily available, you don't need a CPT code. Let's just put in the name of the procedure. Or, when you're given a recommendation for a procedure, that information comes with it. I think that could go a long way towards making the healthcare system more equitable and easy to access.
Thank you, Aneri. Yes, definitely data is key. Laura, Lillian, did you want to chime in as it relates to the importance of data?
Yeah, I think, another area, as I mentioned earlier, one of the problems is that our own experience in navigating the system in many ways is private. Data allows things that are hidden to be revealed in many cases. And so being able to look at, the data of hospitals, and is there, for instance, a inequity or a disparity in how quickly they respond to a woman experiencing a particular issue in labor, in their labor and delivery unit, by race. This is something that has been evaluated. I think, again, from the patient perspective, and especially when you're in these crisis situations, you're just trying to get through and you don't know what's happening to everyone else. By using data as, kind of a quality assessment tool, it can very clearly highlight inequities that are happening. And of course, there are a few challenges here though, right? One is who's actually doing that evaluation and what is their ultimate goal and how transparent will the results be? And also that, if we're going into medical records, it's also how good things were entered into the medical record, how well they were documented. And that can be a problem. But that said, there are still ways to do this. And so data can also be really, I think, powerful, excuse me, as a tool to really examine what's going on here beyond individual clinician experiences, beyond individual patient experiences. Though those, I think, are really powerful to qualify what this data means.
Yeah,
Yes.
I'm going to jump in right on that because, we're all here because we don't like the current state, right? The current state has a lot of brokenness and disparity. And I named my title Chief Changemaker. We're here because we want to make change. We want to make it better. There's a lot of brokenness and systemic brokenness, not just in the healthcare system, everywhere, right? There is a lot of privilege, not just health privilege, and there is a lot of disparity, not just health disparity. And how do we, as a society or as patient advocates or people who are interested in changing the current state, decide how to move change forward? It's through data. It's through information. Information helps us prioritize it, helps us create a sense of urgency, but most important, it helps us find the solutions that will and can work. And that's what we need. And then when we find a solution, the data about whether it did what it was supposed to do helps us evolve it so that it ends up changing the current state into this desired future state where disparity is lessened or removed. So that's the beauty of it. And that's why when there is transparency and visibility issues, not just at the individual patient level, but systemically. It's very hard to make a system be changed into the state that we're all here for.
Yes, definitely. Thank you. And as you mentioned, Laura, definitely there are lots of disparity, not just health disparities. There's food access, there's housing disparity, there's so much disparity. So what resources have helped you get to where you are today? I love the chief change maker is just my new favorite title. So if anyone wants to chime in and share how you got where you are today, and what are your recommendations as far as resources that help you get there?
So I'm a little bit different, right? I'm just a citizen who had injustice happen to them. And then I started an organization and it kind of exploded. I will say the first thing is I was the first mover, right? There was no one in this space. There was not another organization in the entire country looking at drug shortages and making sure patients got care during drug shortages. So that was helpful, right? Giving myself an organization focused on an issue that had been hidden, and a title like Chief Changemaker right there gave me an ability to walk into rooms that I didn't just as Abby's mom. And so that's my first, who is doing the change in the space already? There was no one. I looked and I wanted to just join whatever somebody was doing. So I think part of it is if you find an injustice that no one else is tackling, this might be a place there where you can make great change.
Thank you. Thank you, Laura. Lillian, Anara, if either of you want to chime in, what resources helped you get where you are today? You want to share that with the audience?
So I think by and far the greatest resource, if I'll call it that has helped educate me about the healthcare system are the people who talk to me, the people who are brave enough, compassionate enough, willing enough to share their stories with the reporter, to let me kind of see into their world, because I think it does exactly what Lillian has mentioned a few times, where like our healthcare experience is private. But when I get to talk to so many people and see it and then share that out with others, it helps us see general trends and patterns. Like, no, it's not just happening to one person, or it's not just me, I'm an outlier. This is how the system is set up and how people navigate it. So I think that is my number one resource for folks who are not journalists and don't have this amazing job that I have, where I get to talk to all these people. I would recommend, there's a really great book by Marshall Allen called Never Pay the First Bill, where he basically talks about how the healthcare system is stacked against folks sometimes, but that there are all these different ways to navigate the finances and kind of advocate for yourself. And if books are not your thing, there's a podcast called An Arm and a Leg that covers similar topics. And then one last resource I just like to remind folks about is that there are agencies or individuals that are supposed to kind of support patients in their role. I'll speak about it from like the billing side, because that's where I've done a lot of reporting, but like you can go to your state Department of Insurance. You can go to the Attorney General's office. You can go to local lawmakers. If you want, you can go to a reporter. These are not perfect fixes, and it is unfortunate that that burden is on the person, the patient, the consumer. But I just want to put out a reminder that these people are out there in theory to help support the advocacy work that you are doing for yourself as a patient. And honestly, the more people that go to them, the more they realize this is an issue, and perhaps more inclined they'll be to enact policies that could change the system overall.
Definitely. Thank you, Anara. And that's one thing I've certainly started to do on my own, is in my quest for resources and advocacy, looked at, my state, what opportunities there are to make my voice heard, as you stated before, share your stories, right? And so, looking at your state, wherever you are, if it's Illinois, Maryland, is there a rare disease commission if it's a rare condition? Is there an opportunity for you to join or attend their meetings? Looking at ways that you can amplify voices for other patients is also a key. Lillian or Laura, did you have anything else that you'd like to add as it relates to that question?
Yeah, I think, my venture into this was by accident. I thought that I was going to go into a completely different field, but then similar to Laura's experience, my father became ill with cancer, and we were trying to navigate the healthcare organization, and it was, to put it mildly, extremely challenging. And he was also Middle Eastern, he was Muslim, he was an immigrant. And I noticed things and I thought, that's weird, but I didn't know. I didn't have any further experience. And then I went into, again, working in the community health center. And I had this moment where I said, oh my God, this wasn't unique. Our experience wasn't unique. And that's when it became horrifying. And so that's what pulled me into ultimately public health. And I think, I, like many folks, almost became accidental advocates in this space because there was no other option. I think for me, other resources that have been really helpful are, when you can, talking to other patients. I think, social media, of course, has its downsides, but social media can also be a really powerful tool to connect with other folks who are maybe in the same situation you're in or were in and could offer some insight. There are also patient advocacy organizations that exist that are really helpful. Sometimes there are even patient advocates within the healthcare organization you're trying to navigate. Again, sometimes that can be a little quirky, but they're there. I wish that I could list off like a long array of resources, but I think, part of the reason we're here is because, we're hoping that in having these conversations, more will be created. I do want to highlight, Hillary had put in the chat the AHRQ questionnaire. I was going to mention that, so it's linked there if anyone has any questions or want to explore that further. That can help support you in dialoguing with your medical provider. So it's just another one I wanted to call out.
No, thank you. Thank you, Lillian. So systems can change, and systems change can feel overwhelming. And what can be done? My last question is, what can be done on an individual basis to address change? I think most of you have already touched on this, sharing your stories, looking to connect with those resources. But is there anything that hasn't already been stated as it relates to feeling overwhelmed and, what can be done as an individual patient or advocate or family member supporting someone?
One very quick thing I'll mention, we kind of talked about, asking for information, knowing you have a right to it. But for instance, Lillian mentioned earlier, it's not legal for places to withhold your medical record or to charge an arm and a leg. I've found if you know just like the name of the law, something specific, as opposed to saying like, hey, that's not legal. If you say, hey, this is the law, or when I now go for care and I want an estimate of how much it will cost, I just ask outright generally. But if they're not giving to me, I say, well, my understanding is that the No Surprises Act requires you to give me an estimate. I don't have to know the ins and outs of the law, but just being able to name it helps give you a little more authority in that conversation.
That's a great suggestion. Thank you. I made a note of that as myself. All right, Lillian or Laura, anything?
I'm going to
Anything else that
answer
hasn't been shared?
real quick,
Okay.
both at one, just how did I deal as being overwhelmed with all this new information and navigating this system? And I know it sounds very trite, but it really was at that time, one day at a time. Like, what do I need to do today? Can you make the decisions as small as possible? And then those small decisions build on each other. And I want to tell you that that's how we navigated this health crisis for my child, but also really how I navigate running Angels for Change, as a citizen, founded and, funded organization. Like, how can I break this very gigantic thing that just happened to us that is crushingly overwhelming into small bites that I can do? And if that is, I'm going to breathe 5 times, that's great. Take a pause, breathe 5 times. But like, I use that same, like if somebody calls me in a dire scenario and they need something in 24 hours and I don't even know what the struggle is, who would it like, I start with, what's the first thing? What's the one step? And you would be surprised how much when you just take one step forward and pause, if you feel overwhelmed, you can accomplish both as a patient, but also as a patient advocate. I know it sounds trite, but I would not be here without those moments. Small steps and breaths of pause and saying, I think I can handle what this is.
Yeah, no, thank you. All right, thank you, ladies. That's great feedback. I'm taking notes again for myself as well as my peers that may have not been able to join us. I have a couple questions in chat. I know we've got about 5 more minutes to take questions. One of them, and this is to the panel, how do you navigate if you don't speak the language? And obviously, I think Lillian, you spoke to some challenges that your father had. What would you recommend for someone that's on the call?
Yeah, so this is a big piece, is understanding, how to speak the language. I think, for me and for many others, unfortunately, a big piece of it is once you're already in the situation, trying to seek this information out. I think there are organizations, especially organizations that focus on specific diseases or conditions, that sometimes have documents that kind of offer guidance around these things. Like, Aneri had mentioned, what about the No Surprises Act? What about HIPAA and my access to records? These are not things that the average person is thinking about when they go about their day. They may not know. So that's another source of information. Again, these will already require that you're in it to then even be thinking about finding this information. I think honestly, for me, something I would love to see to address this, because I feel like unfortunately there is not a whole lot of education around this for just the average person, and I know that our health education system is already, that could be a whole other webinar, but I would love to see in schools, in health education classes, information around this, because this to me seems like basic information that would be helpful, basic information that folks could bring with them. And that's something that not everyone, but almost everyone should have access to. I would really love to see that. I think, for those that don't speak the language, again, there are some resources out there. Some of them are specific to particular conditions since they're relevant. A lot of it is more general around, again, knowing what your rights are, saying things like, I would like that documented. I'm not aware of any, singular excellent resource. That doesn't mean it doesn't exist. But those are some immediate thoughts that I have in response to the question.
All right, wonderful. Oh,
When
go ahead,
we-
Laura.
When we have to tackle this, right? I'm just a single organization and I have to tackle this, right? Someone calls me, they don't speak the language, but they're in a drug shortage, and I'm the only one in the country that has an organization that can help them. I will say, first of all, thank goodness for technology, right? There is technology that can help. And sometimes I move it to written, like translate for a little bit to understand the situation. They get the same exact commitment from me if I need to. As an advocacy organization, I can bring in somebody that speaks the language. This is the benefit of having advocacy organizations in the healthcare space to be able, like, focused on specific issues. So, and because it's a drug shortage issue, I may already have a solution. So someone calls in, I can quickly tell them, and with Google Translate, it's going to be okay, and then navigate it with their hospital system who speaks English, right? And then when I have had to navigate a situation outside of the country, I usually rely on supply chain members in that country to help me, and we just kind of navigate it together. But that is the benefit of there being patient advocacy organizations that a patient can call to. It is unacceptable for us to think that a patient in crisis then has to figure that out and translate it and figure out how the healthcare system works in another language. Like, this is why we're here. They then, they find Google, they find me, and then I figure out how to navigate that as best as possible. So
Yeah, sounds like Angels for Change is doing really good work. Thank you, Laura. We are almost at the end, and I wanted to give you each an opportunity to share one call to action for the participants. I do not see, it looks like you were so thorough today in this conversation that we don't have any more questions in Q&A. So what's your one call to action that you like for the participants that are on the line today?
Talk about it. Just talk about it. Talk about your experience. Ask folks about what their experiences has been navigating the system. I think that, again, one of the biggest challenges that we face in addressing this is that so much of this is hidden from view and so much of this is private. But by having conversations, and that doesn't necessarily even have to mean, personal experiences, speak with folks who come to this with professional perspective, who have navigated, and again, many folks who are within the healthcare system as professionals also are patients, so that's always interesting to see when you have these conversations. But yeah, I would say just talk about it, and if you're in school and there's opportunity to have this conversation go in that direction, do that. If you're in a workplace where you have the capacity to have these conversations, and especially if you're in an organization that can make change, have conversations about them. I think, unfortunately, because our system is so broken and, we hear about it all the time, insurance issues and costs, we've just kind of normalized it. And we have to begin talking about this in a way that recognizes this is not normal. This is not okay. And there are other ways to do this. And so all that requires initially is having these conversations. And through those conversations, there could be, mobilizing to make change.
I can say mine is sort of similar. It's to ask for information when you want it, when you need it, from provider, from insurers, from others. Ask for it. Know that you should be getting it. Know when you have rights for it, but really just normalize asking for it, acting like it's just a normal thing for them to give you that information, not like it's some great ask we're making, but like, hey, this is basic information I should have access to. And the more we all ask for it, the more it will become the norm that we should be getting that.
I think what I prove is that we actually, even though there's brokenness that we've all talked about, we actually do live in a country where if you see injustice and you're willing to try to change it, you can. And you don't do it alone. I haven't done a single thing on my own, but I have been the catalyst to change, to stand up and say, there's got to be a different way, and can you help me find it? So I think that's what I show, is that you don't have to accept it, but you also don't have to burn it down, right? You can say, how do we navigate this? Because what is current state is unacceptable, and I want a future that is different. And, I think that's what we show.
Wonderful. Well, thank you, ladies, for your time, your expertise, those nuggets that you just shared with both me and all the other panelists today as patients and healthcare, those that work in the healthcare space. It's really important to have these discussions and know that we're not going to get all the answers today, but with advocates like each of you, there is a positive move forward. And I'm really thankful for each of you. Thank you to ASTARISQ for this series. I encourage everyone to check out the rest of the series. These are great conversations happening throughout the summer, and we encourage everyone to attend. Thank you so much for your time.